We also discussed at the great debates meeting is another very important topic and biomarker in upper GI malignancies and all tumor types, called microsatellite instability, or MSI-high. In early stage esophagogastric, up to 20% of patients harbor hypermutated or MMR deficient tumors. Most of those tumors arise as a sporadic alteration. They're not in setting of Lynch syndrome. And so the topic that we discussed with perioperative therapy for MSI-high tumors, what should we do for them? I advocated for use of immunotherapy in perioperative setting instead of chemotherapy. The debate was structured of immunotherapy versus chemotherapy. If I had to restructure the debate, I would say perioperative therapy or surgery first, because surgery is really such an important part of cure in MSI tumors that's the first axiom in medicine is do no harm. And most MSI tumors, if they're completely resectable and can undergo R0 resection, those patients, overwhelming majority, more than 80%, would be cured with surgery alone. Really where we need to tweak and change the bar is, can we think about non-operative approaches in MSI cancers? In other words, organ preservation, where dual immune checkpoint blockade or even monotherapy anti-PD-1 therapy has been already demonstrated in rectal cancer and now increasingly in upper GI malignancies, that you could have close to 100% complete response. And then can we just watch and wait those, and do we need to even do operation? And then, if we don't offer them immunotherapy in perioperative setting, for whatever reason, clinical consideration, we should probably take them to surgery as opposed to doing perioperative chemo, FLOT regimens, ECX regimens, other chemotherapy-based regimens may increase the risk of adverse events, and the patients may not be able to get to surgery, which is, again, very curative in that for MSI tumors. So a lot of exciting data to learn and to review, and debating it and talking to colleagues is the best way to get your point across in a short period of time. So it was exciting to be able to review two hot topics in upper GI tumors, HER2 directed therapy and approach to MSI cancers at great debates this year. Thank you for your attention.